Hi, my name is John Harris Maurer, and I'm the Public Policy Director for Equality Florida. That means I have a front row seat to see our HIV advocacy project and our public policy department work in the Capitol in Tallahassee. And this year, we had a tremendous year. We beat back numerous attempts at government interference with personal freedom to make medical decisions for oneself. And in coordination with people living with HIV, we helped pass the first proactive piece of LGBTQ legislation in recent history, the PEP Access Bill. That process was so important because it provided a tremendous opportunity for us to do public education and stigma reduction on HIV issues with a broad stakeholder base. We had allies from all sides of the aisle talking about the importance of ending the epidemic and why HIV continues to be such an important issue that Florida has to tackle. We appreciate the partnership with AHF in that work and look forward to continuing to work together in the future.
Hello, my name is Angelique Godwin. I use she, her, queen pronouns, and I am the Director of Transgender Equality here at Equality Florida, and I also oversee the Trans Action Program. As an Afro-Latina trans woman and someone living with HIV, I have a uniquely personal understanding of the importance of education, outreach, and access to healthcare that supports trans people living with AIDS or HIV. Transgender Floridians, especially trans women and trans people of color, face a disproportionately high risk of getting HIV. Attacks on the healthcare access for trans people plagued this year's legislative session, with state agencies weaponize their position against us for political gain. Working alongside grassroots organizations and with our public policy department, Trans Action met these challenges head on. I've personally worked with several organizations to bring education and access to PEP and PrEP within the communities, thanks to the passionate and driven trans organizations I work with. We mobilized hundreds of trans voices to march in the Capitol for the Let Us Live March. And even then, we also gathered 60 trans leaders from across the state for a first of its kind convening called the Florida Voices for Change, where we heard firsthand about how important HIV issues are affecting the trans siblings and began developing solutions to collectively address them. We know the road ahead is not easy, but we are beginning to see the shifts taking place thanks to our work. We will keep centering trans voices in our programming, including the need to proactively address the impacts of HIV and AIDS on our communities, thanks to support of partners like AHF. Thank you so much, and we look forward to working with you in the future.
Hello, my name is Ian Silgestrom, and I oversee Equality Florida's Health Equity and Safe Schools programs. I come to this work as a previous health and science teacher in Jacksonville, Florida. We truly believe that the only way we are going to have a profound impact on the health and wellness of people living with HIV and ultimately end the HIV epidemic in Florida is to get our schools and healthcare agencies to direct major resources to this critical issue. Unfortunately, most of these multi-billion-dollar entities have all but ignored the unique concerns of people living with HIV. We're working to change that. Our team is building deep relationships with hospital administrators, superintendents, and school board members. As a result, many of our schools and healthcare agencies are training staff and implementing new policies to improve care for people living with HIV and to reduce future transmissions. Thus far, our team has trained nearly 40,000 mental health professionals, teachers, nurses, and school or healthcare-based providers. Because of our work, more students can speak with trained adults about sensitive issues, and school districts are implementing LGBTQ inclusive, scientifically accurate sexual health education. Because of our work, people living with HIV and transgender individuals have greater access to culturally competent healthcare and mental health care. We are so grateful for our partnership with AHF, which helps make our work with Florida schools and Florida school districts, along with our healthcare agencies, possible. Thank you.
Hi, I'm Mary Akins-Durant. I use she, her pronouns, and I'm the statewide political and special campaigns manager for Equality Florida. Our current governor has made Florida less welcoming and more dangerous for people living with HIV and the LGBTQ community. We know that to turn the tide will require tens of thousands of grassroots volunteers showing up for every fight. Moms for Liberty and the Proud Boys are packing school board meetings, and every year in Tallahassee brings dozens of dangerous new proposals. Our rallying cry to our community in this time of crisis has been very simple: resist. In the last year, we grew grassroots engagement faster than at any time in our history. In 1 year, we doubled our field team to over 20 community organizers and fellows. We recruited over 4,000 volunteers, and we signed up 110,000 new members. We're showing up for the fight in our schools and have already turned out over 4,000 people to an astonishing 500 school board meetings in 47 counties. We're showing up in Tallahassee, where this year 6,000 of our supporters sent 100,000 messages to their legislators. In addition, over 400 grassroots volunteers traveled to Tallahassee, where they held more than 200 meetings with legislators and testified at 27 committee hearings. This mass mobilization is starting to turn the tide, but we know the challenges ahead will be even greater. Thank you, AHF, for standing shoulder to shoulder with us in this fight.